If you don't test yourself, you'll never know what you're capable of. So kind of putting yourself out there and risking failure, I think, has led me to many more successes. I'm known for running 7 marathons on 7 continents in 7 days and setting the world record for that.
Mike is clearly an elite athlete and an endurance athlete who's pushing himself far more than anyone or most people around the world.
I've run in Death Valley, one of the hottest places in the world. I've run races at the North Pole. The temperatures were in excess of 40 degrees Celsius negative.
Sports and Performance Cardiology program at the MedStar Heart Vascular Institute is the only program of its kind in Maryland, and also the most robust kind in the region, and one of the only in the country. When we evaluate patients, we really look into what they're doing, not only just sport, but how much of it they're doing, so how many days a week, for how long, and how intense they're exercising. And then when they have symptoms, we kind of evaluate all of those in that context. So when you have someone who's really exercising 4 or 5 or more hours a week of aerobic fitness, there's expected changes we expect to see in the athlete's heart or exercise-induced cardiac remodeling. And so interpretation of the EKG is different, interpretation of the echocardiogram is also different. Essentially, the heart's like any other muscle. So if you give your heart a load, which is in running or swimming or in any endurance activity, you have a volume load of your heart. Your heart is pumping more and more blood than the average person who's not running or exercising frequently. So the heart responds to that by changing and becoming more efficient. So it gets bigger to handle that volume load. So we like to use cardiopulmonary exercise testing for our athletes. It measures your oxygen consumption and your ability to exhale carbon dioxide. And one of the main metrics when we use for athletes is a VO2 max, which is your body's maximum oxygen consumption. And for athletes like Mike, it's really important to have that number because you can use it as a base when he's not having any symptoms.
I'm curious about what my VO2 max is going to be. That's something that is an indicator of my current fitness and possible fitness. I'm interested in any abnormalities with my heart, if there's anything going on that I need to be aware of. And then I'm also interested in seeing, it's kind of cool, like you put on this crazy mask and like they monitor your breathing, but you can also hopefully be able to tell when your lactic threshold, when that's established. And so that'll help me know exactly when I kick over to start producing more lactic acid, which is something that as a runner, you kind of want to avoid getting too much of that because that's basically what's trying to slow you down.
Cardiopulmonary exercise testing is better than our kind of routine nuclear stress test or exercise treadmill test for athletes because it's not just testing the cardiovascular system in isolation. It actually tests kind of the whole circuit, the heart, the lungs, and the muscles that are working to kind of work in a circuit.
One of the neatest things too is like you feel like a complete rock star when you walk in there. It's off the ground, looks like a tank. You can just feel the speed like oozing off of it. And there's a bike set up next to it, which is decked out with like, drop bars. And then you have the machine set up to the left. There's definitely a cool factor to it. Dr. Shah's expertise is second to none. Having a 12 and a 9-year-old kid, I love what I do and I love pushing the edge, but I also want to be around to see them graduate from college. If you have the opportunity to kind of work with the best people in the business, I think you should take advantage of that.